Welcome to the EMA office today, where we bring you the latest in the COVID numbers along with Chairman Mark Kern. And today we have Sam Bierman from the Health Department. Sam, glad you was able to get away from the vaccination site.
Yes, we are busy down there. For anyone that has not signed up yet, please do so at the Health Department and on EMA Facebook pages, the vaccine notification form. And when we get to your tier, we will be pulling your information and contacting you. As of today, we have tested 294,208 St. Clair County residents, which is an increase of 1,022 from yesterday. We have 28,475 positive test results, which is an increase of 43 from yesterday. And that does include both males and females from under the age of 10 up to their 70s. Today, our daily county positivity rate is 4.2%, and we have 265,733 negative test results. Unfortunately, we are announcing 3 additional deaths today, which does bring our total to 459. We had a female in her 70s, a female in her 90s, and a male in his 90s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 27,483. For state totals, 18,733,271 have been tested, with 1,201,027 positive test results, which is an increase of 1,510 from yesterday. And for deaths, the state is reporting 20,781, which is an increase of 16 from yesterday. For St. Clair County hospitalizations, currently we have 30 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Regionally, we have 68 patients that are admitted due to COVID-related reasons, and 4 of them are on ventilators. For our congregate living facilities and long-term care facilities that are currently or previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had any changes. Brea of Belleville has 110 cases and 8 deaths, and that is an increase of 5 cases for that facility. And St. Paul's Home has 176 cases and 31 deaths, and that is an increase of 1 death for that facility. And now I will turn it over to Chairman Kern for his update.
It's good to have you here, Sam.
Thanks.
Testing continues at
Testing continues.
in Fairview Heights at St. Clair Square.
At St. Clair Square, yes. And as always, you don't need an appointment. There is no cost to it. You can drive up, and you don't have the app previously on their phone. They are more than happy to show you how to get the app and help you fill out the form
Great.
that you have to.
Thanks, Sam. Okay, let's look at the zip codes. 62203 is up 1 today to 607. 62206 is also up 1 to 1,270. 62207 is down 1 to 577. 62208 up 3 to 1596. 62220 up 1 to 2,033. 62221 up 4 to 2,740. 62223 up 5 to 1719. 62226 up 7 to 3146. 62232 down 1 to 884. 62239 up 1 to 456. 62240 up 2 to 156. 62243 up 1 to 760. 62254 up 1 to 788. 62264 up 2 to 351. And 62269 up 4 to 3,201. 43 new positives, 1,022 people tested, brings our daily county positivity down to 4.2%, which in turn brings our rolling average down to 5.3%. Regional positivity stays the same today at 3.6%. And the counties that make up our region include Bond, which today is at 0%, Clinton County at 0.9%, Madison 4.5%, Monroe 8.7% today, Randolph is at 0%, and St. Clair is at 1.4%, and Washington County at 6.9%. Hospitalizations continue to get lower, Herb. We're at 30 today. That's in the county, in St. Clair County, that's a good number to see. But we want to caution people, St. Patrick's Day is not a time to let your guard down. Let's continue to follow the rules, do the things that we've been doing. Watch the social distancing, wear your mask, wash your hands. Let's get through this St. Patrick's Day holiday and not have a spike. Let's keep going so we can head through to opening day and move into our summer as we like to enjoy our summers.
That's what we're all looking forward to. I know all of Team St. Clair is doing that. And Sam, you've got a lady friend on here says, hello, Sam, I missed hearing your voice and seeing you, Rebecca.
Well, thank you. Well, if you haven't done so, you can come down to the fairgrounds and see me.
That's where she lives.
That's
Yeah.
where I'm at these days, which is, down there. But yeah, for anyone who hasn't had their vaccine, if you do come down, I will try to come out and say hi to you.
Say hi to Sam. And then Janet said I called the 825 number this morning to ask a question. The person answering the phone was so nice and very helpful. So those are the kind of comments that we like to hear. The people in the call center are doing their best to answer as many calls as quickly as possible. And
There are a
efficient.
lot of people still out there that have not gotten a shot. And whether it's because they're not eligible or they just haven't been able to get that, there still is a big number of people walking around that haven't gotten the vaccine yet. So that's why we need to continue to do all of this, and that's why we encourage you to sign up and get ready to go see Sam, because we can roll you through, take a little time during your day, and make this an easy process.
And Sam, one of our other Team St. Clair followers that follows us every day, Gerald, says, is the county running out of a second shot to all that took the first? So
No, we are not. I know that there have been several questions for everyone that was interested or that is due for that second dose of Pfizer. No, we had the scheduling portal up yesterday. We had some issues with it, so we did have to bring it back down, but it will be back up hopefully by the end of today so people can sign up. Do please keep in mind, though, that on that 21-day mark, it does not have to be specifically on that day. Of course, we would like you to get it as close to that day as possible, but going over a few days is not going to make a difference in the long run for the amount of efficacy that the vaccine will have.
But we do have that vaccine in.
Correct.
At least for the first group of second doses, for
Yes.
those that were done 21 days ago. It's just that the program need a little tweaking, and so I think you're
And
working.
technology doesn't always,
I think
work the way we
program-
want it to sometimes.
I think the program's getting tired like all of us are.
I think you're probably right.
had
It's
to take a
probably
break.
getting quite a workout.
So again, if you are due that second dose, you will be seeing that open back up, and then you'll be able to go in and schedule your appointments and then go down and see Sam. So everybody who has showed that interest is going to get their shots without a doubt, of course, as long as that vaccine keeps coming in. As the chairman said, this round is in. We just had a little scheduling issue, so that was taken care of. So be watching it and get signed up to get back down there. Since yesterday, 1,402 people have signed up on the page showing interest in it. That's good. That tells us that people are still interested in getting it. And you keep keeping the vaccine coming, and we'll keep putting the needles in the arms.
We're going to do it. I think teachers are scheduled to get their second doses this weekend, so that should help with the schools, and things are rolling.
Things are rolling. So right now, we're going to roll into Cindy and let her translate this into our Spanish communities, and then we'll be back for day 362, which means we're getting one day closer to that 1 year mark that we never thought we'd be here for. Look at Sam. Sam, just a year you've had to put up
It
with
has
us.
been the longest and slowest year all at the same time.
At the same time. Okay, everybody have a good evening. We'll see you tomorrow.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.